Okay, today we are talking about ankylosing spondylitis. This is one of the seronegative spondyloarthropathies. There are four primary ones that fall under this category. If we were to name them, they would be remembered by the mnemonic pair: psoriatic arthritis, enteropathic arthritis, which is also known as IBD-associated arthritis, ankylosing spondylitis, and then reactive arthritis, also formerly known as Reiter's syndrome. So this ankylosing spondylitis involves the axial skeleton, including the SI joint, so axial compared to appendicular, but basically it involves the spine, as very appropriate of the name spondylo, right? The spine, inflammation of the spine. And this affects men more than women at a rate of 2 to 3 to 1, so 2 to 3 men for every woman that has the condition. The big distinguishing factor is not an antibody, but this HLA-B27, which is a part of a MH1 major histocompatibility complex molecule associated strongly with ankylosing spondylitis, although may also appear in other diseases as well. It is 90% positive in whites with this disease. Shows up positive in 60% of blacks with this disease, and unfortunately I don't have statistics for Asians, Latinos, and others. What's interesting though is it's not determinative, meaning if you check someone, let's say someone that's white, and a lot of them have this gene, only 6% of those people will actually develop ankylosing spondylitis. So there's actually many other risk factors and other genes that may not have been fully elucidated yet, but this is the big one as of now. Now, ankylosing spondylitis, what characterizes it is a few stages here. Basically, on the left here, we have a normal spine with the disc spaces and the facet joints intact. The next step would be inflammation and fibrosis. So you start getting inflamed and destruction of the discs themselves and the facet joints, which are synovial joints, and it gets started. You start forming fibrotic tissue, and it gets replaced by this fibrosis. And finally, if not controlled, it will lead to ossification and fusion. So basically what you can see here at the front of the spine, both in the picture and the x-ray, is what we call syndesmophytes. Okay, so you're getting bone formation where there should not be. There should just be soft tissue there, but now you're getting syndesmophytes. And if you want to break down this word, syn, together, desmo is like the ligament or fibrous, and then phytes, typically think about plants, but actually in this case it's more abnormal. So basically abnormal fusion of cartilage or fibrous tissue here. So that's what's happening in spondylitis. And this is a classic what we call bamboo spine that you see. So it looks like bamboo because there's fusion of where there should be soft tissue. Now, it's not just a disease that affects the spine. Other organs can be involved, especially wherever there's fibrocartilage, and this is true of a lot of the spondyloarthropathies. And so what we see is in the thorax and the lungs, we oftentimes get lung fibrosis, especially of the superior part of the lungs. You can get pain at these entheses, or basically where the cartilage meets the bone. And because of that, and because of other places like between the manubrium and the sternum, eventually you may actually get restrictive lung disease because of inadequate chest expansion. So you get a restrictive pattern. You also get anterior uveitis in about 20% of cases, and this is inflammation of the anterior part of the eye. It can also be found again in some of the other spondyloarthropathies, not to be confused with conjunctivitis, which is actually also found in some of the spondyloarthropathies, more commonly in the psoriatic arthritis and reactive arthritis. Now, kidneys can get involved when ankylosing spondylitis is not well controlled, and oftentimes what you can get, actually I shouldn't say oftentimes, rarely, you can get IgA nephropathy and also AA amyloidosis deposition, of course. So this can cause kidney damage and kidney impairment over time. Finally, it can also affect the aorta where there's fibrocartilage, and you can get regurgitation or dilatation and regurgitation of the subaortic area. And sorry, not finally, one more thing is it affects the other entheses, including where the plantar fascia attaches and where the Achilles tendon attaches. So you oftentimes may see a bulging Achilles tendon. You can get that Achilles tendonitis and also plantar fasciitis. There's other joints that can also be involved as well, but essentially that is the summary that I have for ankylosing spondylitis.